A hearty good afternoon and welcome to the session on how to conceive naturally. We are glad to have Dr. Anuranjita Pallavi among us today to help us understand the topic. She will take us through that and more in this session today. So, before we dive into our session, and as Cryopreservation Month is going on, I just wanted to ask you one question about egg freezing. Like, whom do you recommend this, and maybe what age group?
Okay, thank you so much. Hi, I'm Dr. Anuranjita Pallavi. As she's already introduced me, I'm working at Apollo Fertility, Navi Mumbai. So, yes, Cryopreservation Week is going on, and it is one of the most upcoming topics in IVF, and that is what we are spreading the awareness about. So, yes, indications. When do we go ahead, or when do we say that, we can go ahead with an egg freezing? Now we are living in 21st century where we can actually freeze our age. What I mean by freeze our age means what happens is females are always born with a certain number of eggs which keep on declining with age, both quantitatively as well as qualitatively. So, definitely one of the major indications for oocyte freezing becomes as social reasons, where a female is not looking for kids, where a female is career oriented, where she wants to have kids. Suppose I might not want kid at 27, 28, or I might not want to get married. So in those females, we recommend oocyte freezing, where when she's 25, 28, 29, she can freeze her eggs, and whenever she's ready for conception, she can get these oocytes which were frozen at the age of 28, 29, which are definitely of a better quality as compared to if she's planning to conceive at 38 or 39 years of age. So social reasons, yes, becomes one of the major indications for oocyte freezing, where you can actually freeze your eggs at a very young age, and that can later be utilized later on whenever you plan to have a child. Second, one of the most major indications of oocyte freezing is a cancer patient, where the patient has to undergo chemoradiotherapy, depending upon the treatment and depending upon the cancer types. Now, these chemotherapeutic agents have been found to be gonadotoxic. What I mean by gonadotoxic is they are harmful for the eggs in the ovaries. So even in those patients, whenever they are planning to start with the cancer chemotherapy treatment, they can just go ahead. They can, before the cancer chemotherapy starts, they can go ahead with oocyte freezing. So these are the major two indications where we go ahead with oocyte freezing. One is the cancer chemotherapy patients, and the second one is definitely social reasons, where they want to freeze their eggs, because we are seeing a lot of women coming with diminished ovarian reserve, or the ovarian reserve has declined even at 37, 38 years of age, and they marry late, they are career oriented. So in those cases, definitely oocyte freezing helps. Because now no one wants to get married at 26, 27 years of age. Everybody is career oriented. So these
Correct.
are the major indications of oocyte freezing.
Oh, okay. So thank you so much for sharing your great insights. We shall now begin with the session. Doctor, you have the
Yes,
stage.
thank you so much. So yes, as my topic says, how to conceive naturally. So many of the couples come to us in OPD saying that, madam, we do not want to go for any other assisted reproductive technologies. We want to just try naturally for some time. So what are the advices which we prefer to give these patients? Whenever they want to try naturally. Now, definitely, natural try is advised based on the baseline investigations which they have. For example, whenever a couple walks in and they have not tried for a period of, suppose, 1 year, and they have just tried for 1, 2 months, and they have come to us and they want to conceive. So in those cases, what do we do is we at least get a baseline investigations done. For example, from the female counterpart, we make sure that the ovarian reserve is good, because as I have already mentioned in the beginning of my Facebook, that females are always born with a certain reserve of eggs which keep on declining with age. So definitely, when a couple walks in, when they have not, tried enough for a period of 1 year, at least we advise them baseline investigations. From the ladies side, what we advise them is the egg reserve, that is the AMH. AMH tells us about the egg reserve, and the beauty of this test is it does not require any empty stomach, and it can be done during any phase of the cycle. Secondly, other hormonal investigations which we advise them, for example, thyroid, prolactin. So these hormones have to also be within the normal limits whenever they are planning to conceive naturally. And then the fourth thing, what we advise them is the HSG or the hysterosalpingography or sonosalpingography, whatever suits them. It's like normally we advise them hysterosalpingography, which is an X-ray to know the patency of the tubes. So once to know the patency of the tube, so it is like it is done between 7 to 9 day of periods where we inject in a dye through the vaginal through the cervical area, and we take films as the dye passes through the fallopian tubes. So these are the basic tests which we do in a female, which tells us that okay, female counterpart is normal, tubes are open, she's ovulating regularly, her egg reserve is good, her other hormones are normal. So what is the these were the prerequisites. When do we advise them? Natural conception. Secondly, on the husband side, definitely we advise them on the normal hormonal test, which is like sugars, thyroid, and thyroid. And the main test for males, which is advised, is the semen analysis. For doing a semen analysis, you require a gap of 2 to 7 days. Sorry, you require a gap of 2 to 7 days. And the parameters which we look in a semen analysis is first the motility, first is the count. What is the sperm count? What is the sperm motility? And what is the sperm morphology? How is the sperm morphology? So these are the three parameters which we look in a semen analysis. Count should be more than 15 million per ml. Motility should at least be 32% of the progressive motility I'm talking about, because if it is a non-progressive motility, then definitely the other forms of assisted reproductive techniques have to be tried. And the morphology of the sperms. The morphology should be, according to the Kruger-Stick criteria, it should be 4%. So 4% of morphology, 32% of progressive motility, and count more than 15 million is the husband semen parameters which we require when we ask them for a natural try. And for a female, egg reserve is good. What do we mean by egg reserve being good is anywhere between 2 to 4 is considered normal, the AMH. And then yes, age also. So other hormone values from the female side, so if and the tubal test. So if all these tests of a male and a female of a couple is normal, then we advise them to conceive naturally. So if a patient is having a regular 28 to 30 day cycle, so what do we ask them? If suppose her tubes are patent, the egg reserve is good, no other hormonal issues, the husband's sperm count is normal, and they are at a younger age, between suppose 25 to 35 of years of age. So in those cases, we ask them to have regular relations, alternate day relation. If it is a regular 28-day cycle or a 30-day cycle, then we advise them to have alternate day relation beginning from the 10th day of of their periods for the next 15 days. So why alternate day? Because the whole concept is that the sperms stay inside the female genital tract alive for a period of 3 to 5 days. The alternate day is sufficient, and this is the way natural try is advised to these patients. So a relation from the 10th day of their periods, alternate day for the next 15 days. If a patient is having a regular cycle of 28 to 30 days. Now, second thing, what is if a female is having a 35-day cycle? Then what do we do? See, the whole concept of having relation between from the 10th day onwards, alternate day for the next 15 days is when a female is having a 28 or a 30-day cycle, generally the egg release or the ovulation takes place at around 14th to 16th day of periods. So it'll cover that area. Now, if the female is having a 35-day cycle, so in those cases also, the ovulation definitely will not occur on the 14th or the 16th day. And sometimes it may be delayed, like 21st or the 22nd day, 18th. So the concept remains the same. You just have alternate day relation from the 10th day of your periods, even if the cycle is long. What happens? So this I have spoken about. First thing was when she's having a 28 or a 30-day cycle. alternate day relation from the 10th day of periods. Normally, the ovulation in these patients takes place anywhere 14th to 16th day of periods. If she's having a 35-day cycle, the ovulation definitely is delayed in these patients. It may be 18th or the 20th day. So if even if you're not able to start having relation from the 10th day of your periods, what I mean by 10th day of your periods when I say is taking the first day of period as day one, you count the number of days as 10th day of periods. So 18th or the 20th or the 22nd day, these are just blind methods which we advise them, and alternate the relation from the 10th day of your periods and for the next 15 days. But now what happens if the cycle is shortened? Suppose if the lady has 24 to 25-day cycle, so definitely the ovulation occurs early in those patients. Sometimes the ovulation can occur as early as 10th day, so we advise them to have relation as soon as they finish their periods, like from the 7th day of their period they can start having alternate day relation. So this is the concept which we follow whenever the couple is trying naturally alternate day relation, provided all these things are provided, all the other parameters are normal. The cycles are regular, the tubes are open, the semen analysis is normal. Then we advise them this way to conceive naturally. Sometimes they can use normal ovulation detection kits also, and they can have relation during that time. So this is another method which the couple can follow using the ovulation detection kits. Then thirdly, yes, natural try can also be done by simple. Suppose if she's having some 40-day cycle, it's very hard to determine, and it's very hard to for the couple to have alternate relation, from the 10th day of your periods. So they come to us. So in those cases, what do we do is we do a simple follicular monitoring for them. What do we do in follicular monitoring is, again, the patient comes on day two, then we call them, we monitor the growth of the eggs in these patients, how the egg is growing and when the egg is growing. And when the egg becomes of a like more than 18 then we give them a rupturing injection, and then during that time we tell them to have relation if the couple is not able to have relation in a blind method like alternate day 10th day of periods. So follicular monitoring also helps these patients where their schedule is tight, they cannot have relation alternate day. So in those cases, it is called a timed intercourse where we monitor the cycle, we see how the egg is growing, when the egg is growing, and once we give them the rupturing injection, they can have relation during that time. So these were the methods, which definitely can be used for the couple to conceive naturally. And if all the reports are normal, nothing to worry. You will conceive, and do not stress out on pregnancy, because you'll be shocked to know that when a couple is trying naturally, the chances of them conceiving per month is only 7%. So don't get disheartened that you have tried 2 months and you're not conceiving. So at least you have to try like this for a minimum period of 1 year for us to go ahead with some assisted reproductive technologies. So definitely conception is possible, and during by this method 80 to 90% of couples conceive naturally within a year, and even if they are not able to conceive within a year, within the next year they definitely conceive, provided all the other reports are normal. So let me know, give me your comments how the presentation was, and I'm sure this will help you, in conceiving naturally. So thank you so much. Thank you.